The purpose of this video is to address the concern of overclearance and underclearance that could occur in a full metal crown preparation. Now for this demonstration I am using 4/6 as it will be easier to demonstrate from the angle that I choose to video this demo. One thing that before we start with reduction, I just want you to pay attention to the pre-clearance that already exists, and if you look into the concept, the idea of underclearance is always related to overclearance, and overclearance is related to our failure to look into the pre-existence clearance. So if we think about underclearance, why it occurs, most of the time we are subconsciously aware that overclearance is a point of no return, means the tooth has been damaged and overclearance cannot be corrected. In that way, while reducing the tooth, we become extra cautious, we become really slow, and that's why it starts to take a lot of time while reducing occlusally. So before we start reducing, always spend a minute looking for the points that are prone to overclearance. Now looking into this clip, or from this angle, if we are talking about 4/6, look where the areas are that are prone to overclearance. This area over here, the mesiobuccal cusp that goes into the embrasure, this is more prone to overclearance. And this area over here in the buccal groove, where there is already pre-clearance, this area is also quite prone to overclearance. So before we go ahead, we just highlight the areas that are susceptible to overclearance and try not to touch them or reduce them in a way that it goes beyond our manageability. The burnisher I'm using here has a 1mm tip, and just to give you an idea as to how much pre-clearance is, there is still around 0.5 here and something that around that much over here, could be around 0.3 or 0.4 somewhere in the buccal groove or the buccal cusp. I have marked these lines with the pencil just to give you an idea where I am going to place the depth cuts. Now the purpose of the depth cuts is to give you a visual clue that where you are going to stop reducing the tooth when it comes to the occlusal aspect. So the more the number of depth cuts, the less are the chances of uneven reduction, because the depth cuts will be automatically measured by the instrument or the rotary device like a burr which you have chosen to use and you have measured already. So it will just give you an idea that the area of the depth cut has been already reduced to the required amount. Let's say if it's 1mm, then you know that all the depth cut, all the area that is covered by the depth cut has been reduced to 1mm. Now it's our chance to reduce the intervening tooth substance, to reduce it to that level of 1mm or whatever we choose to. Now when I'm going to reduce or place a depth cut in the central fissure, I won't be covering or reducing up to the marginal ridge, because this is the area that is prone to overclearance, and this area could be covered or be reduced when we will be doing the interproximal reduction with a tapered long chamfer burr. So we can just reduce it up to the level of marginal ridge and just leave it here. Now this burr is, I could not find a burr that is 1mm, but my intention is to place the central cut all the way down to the other side of the marginal ridge. That should be 1mm. So I have remove the tooth structure from the central fissure that's up to the level of 1 millimeter, or a couple of points where it could be 1.2 millimeter, just to give you an idea that it just gives me a concept that even reduction has occurred in the central fissure. So now I can focus on other points. To produce the depth cuts on the other surfaces of the triangular ridges or on the cusps, inclines, I'm just going to use the straight fissure burr. It's a diamond burr, and the only problem with diamond burr is that they tend to abrade the tooth surface instead of cutting them. So if not enough amount of water is used, they used to burn this plastic. So that's the only concern. Similarly, now I am able to rotate it because that's the best way I can demonstrate it. But in actuality, when it's on the typhodont and it's on the stand, then you just have to move around to complete this kind of reduction. Now just be careful while reducing on the occlusal part. We are just doing on the occlusal aspect, and we won't be trying to reduce it up to the level of 1 millimeter on the buccal part that forms a part of the occlusal surface. So if I place the upper jaw right here, I will always make sure that the depth group doesn't comes on the occlusal part of the buccal surface where already some pre-clearance exists. So these are all the depth cuts that I have placed on the occlusal surface. And one thing that I want to address, that I didn't touch the marginal ridge. As I said before, that that will be taken care of when we will be doing the proximal reduction, and it's at that time we are going to check the clearance that lies especially in the embrasure area, and that's the area that is more prone to over clearance. Now, if you have a concern that you are taking too much time to reduce the occlusal aspect or trying to achieve the clearance, probably it also sometimes matters that what kind of burr you are using. If I'm using such a burr like this, it's gonna take me a long time to remove all this intervening tooth structure. And the purpose of these depth cut, in fact, is to that giving you a visual clue that where to stop reducing, since you have achieved the desired level where you want to go to get the required clearance. So this is something, if you are starting your task during exam, the first thing during the day, you can go ahead do that. But let's say you are doing it at the end and you have limited time remaining and you don't want to spend too much time removing this while you are already having occlusal clues that to help you get to the level that you want to, you can choose a different burr that removes the bulk of this tissue tooth substance more quickly. Now I have this burr here. It's a football shaped burr. I'm using fine, but you have option to use a coarse or medium grade burr that removes this tooth substance very quickly. So based upon these visual clues that I have acquired from these depth cuts, I should not be scared enough to reduce the occlusal structure, because I know now where I have to stop. I have achieved the desired clearance of 1 millimeter all over, and that's what my goal is, to achieve 1 millimeter everywhere by removing the tooth structure that is intervening between the depth cuts. I have excused marginal ridges from reduction. I'm not doing any reduction on the occlusal part of the buccal surface, which is also prone to overclearance. So I should not be scared to remove all this area. And this part, the occlusal part of the buccal surface, which forms a part of the occlusal surface when we will be checking the clearance, I would like to say that you can reduce this part after you have reduced from all other aspects. You have reduced interproximally and axial surfaces, and based upon whatever clearance that you desire or leftover that you need to achieve, you can reduce it from that part. In that way, it gives you a kind of safety method that you can prevent the overclearance from happening. So I will just go ahead with this burr and remove the intervening tooth substance quickly. Now it just takes a little bit of practice, just like with any other skill, to get hold and feel the burr in your hand, how is it functioning, so that you just become a little bit comfortable. Yeah, move around the typhodon and just reduce these intervening structures so that you bring the occlusal aspect to the level that you are looking for. There's a lot of debris that I have to blow it away before I could see it properly. I can see a cavity-like structure here where you can see that there is a depth cut still clearly visible, so we just have to blend it with the rest of the tooth structure. A part of it we can deal with when we have reduced interproximally, since at that time we will know about the clearance and other stuff. Now when you look at this clip, even though I have reduced occlusally by 1 millimeter all over, but if you bring the teeth in occlusion, you will hardly see anything that being reduced. So two options here: either to reduce the occlusal part of the buccal surface at the end, so that you don't go past over clearance, or go past the required clearance, and which if it's your major concern, or else if you have accomplished that dexterity or good control over the handpiece, you can choose to reduce the occlusal part of the buccal surface right away when you are reducing the occlusal surface. So in the case you want to do that, you can place depth cuts of 0.5 millimeter, very tiny, on the occlusal part of the buccal surface that will be angled in this way right into the buccal grooves, and then on the cusps, which will be angled around 45 degree to the surface. And once that is done, you can remove the intervening substance from between, and you should be okay, because the clearance that is required is somewhere from 1 to 2 millimeter. And if we look at the occlusion right here, I'm using this burnisher of 1 millimeter. Even after you place the depth cut, you should be okay. Clearance should not be more than 1.5 millimeter. But if you have a major concern about over clearance, skip this step until you have completed reduction from all the surfaces. So now the final test of our reduction, whether we have acquired the desired clearance or not. And there is only one foolproof method, and that is to place some composite onto the occlusal surface. So I have used this composite here. Remember, I'm just going to check the occlusal clearance, and it's just to give you an idea that how can we do that without compromising our ability to measure it correctly. This is just one way that you can be confident that you have achieved the desired clearance. And now make sure there is no bond or anything that's going to stick to this composite on the surface of the tooth. I have an option to put a little Vaseline that you can do if you want to do that in the exam, so that it comes out easily. But otherwise, it will just give you a good idea if you have achieved the desired clearance or not. I'm going to compress it. And cure it. So this is how the composite looks from here, and it's not solidified yet, so I'm just going to cure it from the other part. So before you take it out, you have an option to mark it with a pencil so that you don't lose its orientation, whether which part goes on the mesial side or which part goes on the distal side. So just give it a reference point so that if you need to place it back, you won't be wasting any time finding out the right orientation. Now if I take this out, I'm going to check the clearance using this caliper here, and you can see I have achieved just one, or maybe just underneath one, which can easily be corrected when we will be in our polishing and finishing stage. How about here? I will start with the points that are in the deepest region. So here you can see we are short of the clearance and we need to reduce it. We can easily do that during the finishing stage, or we can do it right away. So it's close to 1.7. This is where you need to be careful about. And when you place, in order to find out these spots, you just have to place this tab back on the tooth surface and you can find out where exactly you went beyond or close to the required amount of clearance. So I will always check in the deepest portion, that is in the fossas first, and then I will go on the inclines. So 1.5 we are good here. We are just close to 1, so we will need more reduction here. We haven't done anything in on the ridge, so just around the ridge you can get an idea here. So we are 1 here. Now this also needs practice, even though it gives you good results and predictable results, but still you have to practice doing this consistently so that you can confidently do this in exam without wasting any time. So try to make it a habit, at least for a few times in a week, when you can use this composite to check the. One more thing about doing this step is to do this once you have reduced all the surfaces, because if I place this here and you start checking the clearance and with the opposing jaw in place, let's take a look from a different angle. It's just to give you an understanding. So if I show you from here, from the lingual aspect, even though you are not able to see it when it's completely attached to the typhodont with the articulator, there will be a lot of room here that you will see it as a clearance or excessive clearance. If I measure this area with the caliper I'm using, it's gonna show over 2 millimeter. But let's take this out now. So if you look at this from the lingual aspect, there is a chance that it could show clearance more than 2 millimeter. The reason is that we haven't yet reduced the lingual surface. Once the lingual surface is reduced, these inclines are going to come more closer to the upper tooth, because the outer area that's showing increased clearance will be gone once this lingual part is completed with reduction. So that's just to give you an idea. Do not perform this step of checking the clearance using composite unless you have reduced all the surfaces. So this is just a way to check for over clearance, under clearance, and I know we are over cautious while reducing the occlusal part, since we are scared of over clearance which cannot be corrected, and that's one of the thing you can do by taking these measures of placing depth cuts, and then you don't have to worry about, since you will be quick in reducing the intervening substance. For this marginal ridges, that's the area prone to overclearance. Wait till you have reduced the proximal part, and then you can check the intervening clearance. Using ball burnisher will be enough, or any instrument that you have pre-measured should be good enough. And do the final reduction or final modification if you required once you have checked the clearance with the composite that you will be placing on the occlusal surface, and bringing them in occlusion, curing the composite, and checking the various points of clearance using caliper.